A growing network of so-called doctor detectives is giving hope to patients with rare and identified conditions. The group has solved 132 mysterious medical cases and has identified 31 new conditions. Dr. Tara Narula reports.
For years, the Miller family has faced an uphill battle, trying to find a diagnosis for their two sons, Carson and Chase. The boys, now 5 and 6, have been unable to walk, stand, or speak since birth.
You hardly had any lunch.
Originally, they were diagnosed with cerebral palsy, but their parents felt their symptoms didn't match up.
There were many nights when we were up wondering why this is happening, why can't the doctors help us? What else can we do?
The family eventually applied to the Undiagnosed Diseases Network, or UDN, where doctors attack medicine's toughest cases by offering families access to cutting-edge genetic research at no cost. Wednesday's report in the New England Journal of Medicine says the group has completed evaluations on 382 patients and diagnosed more than a third, often through DNA analysis that uncovers a rare genetic mutation. Dr. John Bernstein works at the network's Stanford site.
For some of our patients, we've looked at the genomes of all of the microorganisms that may live on their blood or in their body. Ultimately, what we're really trying to do is find patients who are similar to each other. That's really what the foundation of diagnosis is.
The report also says nearly 60% of the network's diagnoses lead to recommendations regarding a change in therapy or treatment. Earlier this year, doctors found a gene mutation in the Miller brothers, leading to a diagnosis of MEPAN syndrome, a rare metabolic disorder.
Okay, Carson, ready? Open.
We actually have a chance at helping the boys figure this out. Like, there's going to be some next steps here. There's going to be people that hopefully we'll be able to talk to now because we have a leg to stand on, having a diagnosis now to look at.
The Millers say there are no proven treatments currently available, but the diagnosis will help them build a coalition to fund future research.
The more patients you have, the more families, the more resources, the better your chances are of securing funding. We've come a long way, and it's through programs like the UDN that I think is putting some sense around all of this.